afternoon. My name is Yaseen Awad-Igbaria. I'm a PhD student at Chronic Pain Laboratory. I'm working under the supervision of Professor Jacob Bonschen and Dr. Ilan Baltzor. Today I will talk about the development of provoked vulvodynia in animal model. First, what is vulvodynia? Provoked vulvodynia is chronic vulvar pain of unknown origin lasting at least 3 months. It affects 8 to 28% of all women of all ages. Women with provoked vulvodynia report localized hypersensitivity and severe pain of vulvar vestibular abdominal camp of vaginal penetration, for example, sexual intercourse. As you can see here, the vestibule and the location of the pain area. In addition, provoked vulvodynia is associated with mental health disorder like depression and anxiety. The pathogenesis of vulvodynia is poorly understood. However, multiple studies suggest that there is a correlation between vulvar inflammation and the development of provoked vulvodynia. Interestingly, women with provoked vulvodynia often report recurrent outbreaks of vulvovaginal candida. The result of this paper led us to the initial inflammatory theory. According to this theory, there is a primary trigger, for example, candida or infection in the vulva that causes inflammation. And during inflammation, there is a robust increase in the inflammatory agents that mediate the development of provoked vulvodynia. In the current study, we aim to investigate this mechanism, and to be more precise, we aim to investigate the development of persistent vulvar hypersensitivity in the rat model of provoked vulvodynia developed after 3 rounds of inflammation challenge. So when it's come to the method, what have we done? Before the inflammation challenge, we measured vulvar sensitivity with an electronic non-fried device to determine the baseline of vulvar sensitivity 7 days between the first inflammation challenge. In the current study, we use zymosan to achieve inflammatory response. Zymosan is the yeast cell wall and widely used in the inflammation and in pain research. Zymosan was injected in the vulva 3 times 7 days between each injection. To the control group, we inject saline 3 times 7 days between each injection. Vulvar sensitivity was measured 2 and 5 days after the inflammation challenge, and after the third one, we measured every 20 days. In addition, day 160 after the inflammation challenge and 162, we performed a elevated plus maze test and the open field test to assess the exact level of the animals. So let's move on to the result. First, here we demonstrate that only in the zymosan challenge rats there was a significant decrease in mechanical sensitivity. The reduction in mechanical sensitivity, as you can see here, was maintained for approximately 5 months after the last inflammation challenge. In comparison to the control group, as you can see here, the reduction in the zymosan group was not recovered to the baseline. In figure B, you notice the frequencies of the rat that developed chronic vulvar pain. The cutoff of the rat had a vulvodynia or not is defined as 30% reduction in vulvar mechanical threshold compared to the baseline. And in the current model, we found approximately 19% of the rat developed chronic vulvar pain. Together, the current results suggest that repeated vulvar inflammation causes long-lasting vulvar hypersensitivity in rats. In further analysis, we performed elevated plus maze and open field to examine the anxiety of the animals. If the animals feel high level of anxiety, to spend more time in the closed arms, less time in the open arms in the elevated plus maze test, and would spend less time in the center of the arena in the open field. As seen in figure A, we found that the zymosan group spent more time in the closed arms and less time in the open arms compared to the control group. However, in the open field, there was no significant difference between the 2 groups, but the calculation of the anxiety index that take into account several parameters of these 2 tests indicates that the zymosan group expressed a high level of anxiety compared to the control group. Furthermore, we also detect a negative correlation between the decrease of the vulvar mechanical sensitivity and the anxiety index. Together, the results suggest that chronic vulvar pain in rats leads to an anxiety-like behavior. To the molecular aspect, hyperinnervation and mast cell accumulation are the 2 most consistent features of provoked vulvodynia. Here we use a neural marker, PGP 9.5, to assess the sensory hyperinnervation at 2 time points after the inflammation challenge, after 20 and after 160 days. As you can see here, at the 2 time points, there was a significant increase in the density of the nerve fiber of the zymosynic group. In addition, among the zymosynic group, as you can see here, the nerve fiber were located near to the epithelial surface. This raises the possibility that the increase in the density of the nerve fiber increase also the expression of the pain channels. Therefore, we examined our hypothesis and we performed the double staining of the TRPV1 channels, which is responsible for heat and burning sensation with the neural marker, and the TRPA1 channels, which is responsible for cold and mechanical sensation. And we found approximately after 5 months, there was also still a significant increase in the expression of both pain channels. Consequently, our result indicates that the primary trigger, in this case the zymosan, induces inflammation, which in turn promotes hyperinnervation and neuromodulation, and eventually resulting in mechanical vulvar hypersensitivity and high level of anxiety. This result raises a question about the early inflammatory events that mediate this process, so we attempted to investigate some elements that we think that are involved. First, the mast cell accumulation. The reason that I asked to examine mast cells, it is because there is substantial body of evidence suggests that mast cells are involved in the developmental process and the maintenance of the chronic vulvar pain. Here we performed a double staining of chimeras and tryptase, and we found after 20 days there was a significant increase in mast cell number. In addition, there was a significant increase in the diffuse tryptase staining. This pattern of staining suggests that mast cells were degranulated. Also, we examined the transcription level of the vulvar nerves at the sacral nerve and dorsal root ganglion, which is responsible for the vulvar and the vaginal. And I just summarize the transcription and at the mRNA level, and we found a significant increase in the transcription of the pain channels. Some elements that are related to neuroplasticity, the NMDA subunit NR2A and NR2B. Also, the section factor CGRP, and upregulation of the neuroproliferation nerve growth factor and the receptor tyrosine kinase. This result raises the possibility that neuroplasticity and the neuroproliferation are the two main pathways that leading to the development of the disease. So, glutamate is the main factor, the main player in neuroplasticity, and NGF is the plays a critical role in the hyperinnervation. So we checked during the inflammation, as you can see here, the timeline, the glutamate concentration and the NGF concentration. Can check here the timeline after each zymosan injection. We measure glutamate and NGF after 6, 24, and 48 hours. And as you can see here, the glutamate concentration, there was a significant increase in glutamate concentration after each zymosan challenge at each time point. However, in the nerve growth factor, we found only a significant difference in the first and the second round. In the third round, there was no significant difference between the saline and the zymosan group. However, the zymosan group tended on average to express a high level of NGF concentration compared to the control group. I like by emphasizing some main points of the current study. First, the zymosan challenge rat developed significant mechanical vulvar hypersensitivity that persisted over 5 months after the inflammation challenge. Anxiety-like behavior were observed among the allogenic rats in the zymosan group compared to the control group. During inflammation, there was a robust increase in mast cell activation, NGF, and glutamate concentration. In addition, we found some elements of that involved in central sensitization and neuroplasticity, the NMDA receptor and markers. And we found a sensory hyperinnervation and increase in the pain channels after 20 and 160 days of the inflammation challenge. Thank you for attention.